The U.S. urgent care market operates at a massive scale. We are looking at over 170 million patient visits every single year, driving an industry valued at over $34 billion. But behind that volume, revenue leaks out of clinics daily, an operational drain that owners feel, even if they haven't quantified the numbers. Initial claim denial rates are trending upward, hitting 15% in 2024. Managing them is also getting more expensive. The administrative cost to fight a single denied claim jumped 30% in 1 year, rising from $43 to over $57. Because of that expense, practices often lack the bandwidth to chase every rejection. 60% of denied claims are never resubmitted, representing permanent, unrecoverable revenue loss. General billing teams consistently underperform in urgent care because the environment is structurally different from a scheduled physician practice. It moves faster, and patients often arrive without confirmed insurance coverage. In this high-volume setting, providers work quickly. A physician might document a rapid strep test, an X-ray scan, or a wound repair, but the billing team might only submit the basic evaluation and management code. The ancillary services are provided but never billed. This data illustrates the root causes of these denials. Coding errors and incomplete documentation account for 35% of all rejected claims. Recovering those errors requires experienced staff, but the industry faces a structural retention problem. Medical groups saw a 40% turnover rate for front office support roles in 2022. The true financial burden of an in-house biller goes beyond base salary. Once you add benefits, payroll taxes, and the $25,000 required to recruit and train a replacement, a single full-time employee can cost a practice $75,000 a year. Even with the budget for those costs, the talent pool is tight. 63% of providers report significant challenges just finding qualified billing staff to hire. The traditional in-house billing model is not built for this high-volume environment. Practices cannot simply hire their way out of the complexity. Smart practices are shifting away from the cycle of hiring and turnover, moving instead to dedicated, outsourced specialist teams. Staffingly provides this model, assigning dedicated teams comprised of fully AAPC and AHIMA credentialed experts. These specialists focus specifically on urgent care. They understand the nuances of ancillary split billing, complex modifier applications, and the documentation required to satisfy payer audits. This transition uses your existing infrastructure. The Staffingly team works directly inside your EMR environment, including platforms like Epic, Athena, or eClinicalWorks. Deploying pre-trained specialists eliminates the typical 6-month onboarding lag, immediately addressing the revenue loss caused by coding mistakes. Human expertise is supported by technology. To manage the high volume of modern urgent care, Staffingly utilizes an AI-augmented workflow. This flowchart shows how claims are automatically routed based on payer rules and denial history. Each claim moves to the best-equipped specialist. Before submission, automated audits scan for missing documentation and coding inconsistencies. Errors are flagged and corrected in real time. During volume spikes, such as flu season or back-to-school physicals, predictive workload management ensures the team handles the surge without a drop in accuracy. Combining AI speed with human precision protects the first-pass resolution rate, removing the workflow bottlenecks that typically cause claims to age out. Looking at unit economics, the math is clear. Replace the $75,000 annual burden of an in-house employee with a fixed cost of $399 per week. This model maintains an error rate below 1% across millions of claims. This combination of lower overhead and high coding accuracy means recovered revenue drops directly to the practice's bottom line. EMR access is established within 48 hours, the dedicated team goes fully live in 14 days, and there are no long-term contracts. The system provides full transparency. Office managers and CFOs can track ROI, throughput, and accuracy through weekly KPI dashboards. Stop letting staff turnover and unworked denials drain your profits. Book a demo to start your 14-day risk-free pilot.